Now, somebody's listening and the person says, Doctor, my blood pressure is high. I'm told I have hypertension. Will I come down with kidney failure? And there's somebody listening right now. This person is diagnosed of hypertension. Person is scared. Now I have high blood pressure. Will my kidney fail? What would you want to tell that person?
Okay, so first of all, hypertension is not a death sentence. Number one. Number two, that you have hypertension does not mean automatically you're going to have kidney failure. Hmm? So when you are diagnosed of hypertension, what we want to do as medical doctors is to help you bring it back to normal range. Because when it's the only problem, the times that you start to have complications with hypertension is when it is high for a long time. That's when you start having problems. Do you understand? So if you come early, you present early, and then we start you on the right medications or the right lifestyle modifications or things to do, and we realize that we can control it, you can live to your 80s, 90s without ever having kidney problems. Do you understand? But the important thing is that once you see that you have hypertension, the first doctor that you should see, or the only doctor that you should be seeing constantly, is make sure you have a nephrologist you are seeing. Do you understand? Who is a nephrologist? A nephrologist is a specialist in kidney health. Why? Because the nephrologist is the one that is going to help you monitor your blood pressure in a way that it will not cause damage to your kidneys. Now, say you've come down with hypertension for a long time now, and you're already having some form of damage to your kidneys. Now, there are different stages of this damage to your kidneys. There is the stage 5, there's the stage 1, stage 2, there's stage 3, stage 4. Do you understand? Stage 5 is the bad one. So, say you come down, maybe you have like a stage 2 kidney disease, call it chronic kidney disease. If you see a nephrologist can help you keep your stage 2 from progressing to stage 3, 4, and 5. I've seen patients that have been stage 2, and because of the seeing their nephrologist, they've gone from stage 2 back to stage 1. I've seen patients go from stage 3 to stage 2 to stage 1. In the same vein, I've seen patients go from stage 1 to stage 5 because of they were not compliant to medications, they were not compliant with their doctor visits and things like that. So the important thing is that if you have hypertension, and I know we don't preach this enough, but it's important for you to see or have a nephrologist you're seeing, even if it's once in 3 months, so that they are watching your medications, they are reviewing your drugs and all that. But as I said, that you have hypertension does not mean that you would come down automatically with kidney disease. The only time you have a high chance or you're at high risk of coming down with kidney disease is when you are careless with your health, you are not using your medications, you are not seeing your doctors, you are smoking, as I said, you are drinking, you are taking agbo and all those things. That's when most likely you will end up on the machine.
Thank you, Dr. Sheyi. I'm glad to have you here. Um, is it possible that a child can need dialysis? We spoke about adults, 30s, 20s. Is it possible? Children can
In
have.
kids, most of the time, theirs is more congenital. By congenital, I mean things that we were born with. Do you understand? So yes, we've had kids that have needed dialysis. So you see kids with things like maybe nephrotic syndrome, and other things. You see them coming down with kidney problems and then they need dialysis. Some kids you see them, they have only one kidney, and the one kidney they have is not functioning well, unfortunately. They come down, then they need dialysis. So it's unfortunate that we see some of these things, but it's not so common. But it's possible for kids, children. I've had kids that have come for dialysis before, and all that. So yeah, in kids. So as much as you're taking care of yourself as an adult, watch out for your kids too. Basically, that's what I'm saying.
Now, let's go to the part that most people don't want to hear. What happens if after all the dialysis, the person does not listen, does not follow the advice, coming for dialysis, what happens?
So it's unfortunate, but when it's a what's the word now? It's a nightmare, quote unquote, for patients when they come down with kidney problems. Why? Because it only gets worse. Once your kidneys have failed, and you don't get transplanted, the honest truth is that it only gets worse. So you see some people that start with one session dialysis, before you know it, they move on to two-session dialysis, before you know it, they move on to three-session dialysis. And then they have to be on it for a very, very, very long time. Now, number one thing is that your finances are going. because you need it controls. My consultant would say that the specialist would say dialysis controls your life
Mm.
because now you cannot travel without considering if they have a dialysis center over there. You cannot go for vacation without considering if they have a dialysis because you have to know that you can get your dialysis as frequently as possible. And the unfortunate thing is that even after all this, there is no cure for kidney disease. There is no cure for kidney disease. There is no cure for kidney disease. I've had patients on dialysis ask me, Doctor, when is my kidney going to heal? And it's always sad for me to tell them there is no cure for kidney disease. And even after transplant, there are some people that will transplant and then they have there's something we call transplant rejections. I've had patients, unfortunately, that had renal transplants, and then after a while, after 1 year, 2 years, they're having rejection, and before you know, they pass away. So all the money they've done for dialysis, for transplants, for everything, down the drain. So don't say because of their dialysis I'll have kidney problem. Trust me, you don't want to get to that stage. There is no cure. But there's no we have not come up with something that would automatically make your kidneys heal. The kidneys don't heal. Do you understand? The kidneys don't heal. Yeah. So it's one of the bad things that I will have to deal with in this profession because you see people, jovial people that, that come for dialysis and all of a sudden they are no more, because of it's just what it is. So it's the best thing for you is prevention is better than spending your money and running up because I will not even say cure. There's no cure. It's better than spending your money and going up and down and ending up still living a miserable life. It's not something that you want to go through.
Have you come across the people who has any of your patient come to you and told you that there is somebody that says they can cure my kidney failure for me? There's somebody online. The person says if I
Uh-uh.
they
So
can.
the word is usually this drug. They say it will wash my kidneys. It will wash my system. That's what they usually use. This drink would wash my system. This drink would cure my kidneys. They told me that this one will help my kidneys work well. And then I look at them and I'm like, this particular thing is what got you to this place. How would you expect to use this particular thing to get you out of this place?
Hmm.
Do you understand? There is no so for everybody watching Dr. Frederick's live now, this is coming from a doctor that had experience with kidney patients. There is no cure. There is no cure. I will say it one more time. There is no cure for kidney failure. There is no cure for kidney failure. It's either you're on dialysis for a long time or you're going to do transplants. And even when you do, although transplant significantly increases your quality of life, because yeah, if younger people that come down with kidney failure that are able to do transplant and overcome it and are consistent, it significantly improves their quality of life. But that your kidney has spots, that kidney has spots, there's nothing that's going to happen again. So, yeah.
Okay, there's a question here. Let me read the question. It says, is frequent urination and one-sided pain on the abdomen, can this be a sign of kidney disease?
Mm. Okay, so frequent urination can point to so many things. So frequent urination can point to possibility of a UTI. It's possible that the person might have a UTI. It's possible that the person, if it's a man, maybe it's 40s, 50s, 60s, it's possible that he may have maybe a prostate issue. You know, it's possible that a man can have a prostate cancer and is presenting with that, things like that. So really anything that causes irritation around the urinary tract would make you go to the toilet more frequently. You understand? So now if you're saying you're having frequent urination and maybe you're having painful urination with it, and maybe you have a back pain, it's possible that you might have an actual urinary tract infection, maybe, and you should go to the hospital. Go to the hospital. I'm not going to tell you what to do. If you're having those symptoms, go to the hospital. Let's investigate. Let's carry out because some of you will go to ChatGPT and ask, I have frequent urination. I have this. Does that mean I have kidney failure? ChatGPT will always give you an answer. But ChatGPT is not doing any tests for you. So come to the hospital. Let's review you. Okay? But yeah.
I've had someone told me that she can cure kidney disease with herbs.
Congratulations to that person. It's just unfortunate when I see some of these things because it's people's lives that are at stake here. And trust me, this is coming from someone in the health system. You don't want to be sick in with Nigeria's current health system. You don't want to be sick in Nigeria's current health system. I'm just going to tell you, except you have a lot of money and except you are boxed up. I'm not going to say more than that. So please, please, oh, go and tell that woman that is saying she can cure sick. Just tell her congratulations and more grace to her elbow. But please don't patronize because there's nothing curing your kidneys, please. There's nothing curing your kidneys. And there's something I also forgot to mention. Things like HIV can also lead to kidney problems. Long-term HIV nephropathy. So we also have patients like that, that come down with kidney issues. So if you turn out that you're HIV positive, make sure you go to your doctor as soon as possible and start medication you need to start on as soon as possible so that at least your viral load is good and then you don't come down with things like that. All right, guys. So I have to go now. Dr. Frederick, it's always nice connecting with you.
Yeah.
Keep up the good work. You are doing so well.